Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about pigments and minerals, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. I will discuss indicative repertoire, knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the third subsection of the second section, demonstration techniques, called pigments and minerals. The portfolio offers indicative repertoire for this subsection that includes pearls, Masson-Fontana, Orsian, von Casa. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. The first knowledge requirement is principles of pigment and mineral demonstration. Candidate needs to have the knowledge and understanding about demonstration of pigments and minerals. You could ask the candidate to explain what pigments and minerals are, to list examples of pigments and minerals, to explain how to demonstrate them, to list technique used to demonstrate them, to explain how these demonstration methods work, to name diseases that can be detected by those methods, to explain how the positive staining would look like. When addressing this knowledge requirement, candidates should consider iron, copper, melanin, bile pigments, lipofuscin, asbestos, calcium and urates, stains highlighted in the indicative repertoire and in-house demonstration methods like pearls, Orsian, Masson-Fontana, bleaching, or von Casa, the principles of those stains, their methodology, the practical application of those stains, reagents used and why they are used, control material, positive staining, associated diseases and so on. The second knowledge requirement is principles of the pathophysiology of pigment and mineral formation and the types of pigments and mineral normally deposited in tissue. Candidate needs to have the knowledge and understanding about pathophysiology of pigment and mineral formation. You could ask the candidate to explain how pigments and minerals form in human body, name tissues that normally store them, to explain the pathophysiology of pigment and mineral formation in the body, to list tissues that can have pathological deposition of minerals and pigments, to name diseases associated with pigments and minerals. When addressing this knowledge requirement, candidates should consider pigments and minerals like iron, copper, calcium, melanin, lipofuscin, urates, asbestos, bile pigments, formation via melanogenesis, biomineralization, iron and copper metabolism, heme catabolism during bile pigment formation, lipofussinogenesis, crystallization during urate formation, deposition in tissue like skin melanocytes, liver, spleen and bone marrow, lungs, bones and teeth, blood, biliary tract where pigments and minerals can be deposited. The third knowledge requirement is principles and practice of routine staining and impregnation methods for the demonstration of pigments and minerals. Candidate needs to have the knowledge and understanding about demonstration methods for pigments and minerals. You could ask the candidate to name the demonstration methods used to detect pigments and minerals, to their principles and practice of those staining methods, to list reagents they used and why, to explain their application. When addressing this knowledge requirement, candidates should consider the stains highlighted in the indicative repertoire, stains used in their department, their principles and practice, their mode of action, reagents used, their application. The fourth knowledge requirement is pathological significance of variations of expression of pigments. Candidate needs to have the knowledge and understanding about expression variation of pigments. You could ask the candidate to explain, what is normal expression of pigments? What is pathological significance of pigment expression variations? What is the clinical implication for the patients whose expression of pigments change? When addressing this knowledge requirement, candidates should consider pathologies like metastatic, dystrophic and idiopathic calcification, hyper and hypopigmentation, melanin loss, presence of asbestos bodies, systemic or localized iron overload, presence of wear pigment, tattoo ink migration to lymph nodes, carbon deposits due to environmental or occupational exposure, accumulation of copper, presence of crystals in urine or joints, jaundice. The fifth knowledge requirement is review cases and material microscopically for internal quality control and external quality assessment. Candidate needs to have the knowledge and understanding about microscopic examination of stained slides for IQC and EQA. You could ask the candidate to explain how to assess quality of relevant demonstration methods, to explain the need for controls, how would assessment be done by EQA assessor, to list quality criteria used by EQA schemes, how to record the process. When addressing this knowledge requirement, candidates should consider color balance and consistency, specificity of staining, uniformity of staining, presence of backstaining, contamination or deposits, presence of non-specific staining, EQA assessment criteria, control material used, documentation. The sixth knowledge requirement is key clinical conditions where these demonstration methods may be of diagnostic value. Candidate needs to have the knowledge and understanding about diseases that could be diagnosed by using relevant demonstration methods. You could ask the candidate to name the clinical conditions that can be detected by using those demonstration methods, to explain the diagnostic value of those demonstration methods. When addressing this knowledge requirement, candidates should consider Wilson's disease and copper, hemochromatosis and iron, mesothelioma and asbestos, melanoma or vitiligo and melanin, jaundice and bile pigments, Batten disease and ceroid, lymphadenopathy and pigments, gout or nephropathy and urates. The seventh knowledge requirement is risks and hazards associated with pigments and minerals demonstration methods. Candidate needs to have the knowledge and understanding about risks and hazards associated with relevant demonstration methods. You could ask the candidate to list the risks and hazards associated with demonstration method for pigments and minerals, to explain how to minimize or prevent them. When addressing this knowledge requirement, candidates should consider health hazards, physical hazards, environmental hazard, disposal methods used, risk assessments, regulatory bodies like COSH, HSE or Ritter, substitutes available to reduce risks and hazards, preventive measures like PP, ventilation, waste segregation and safe handling. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is follow demonstration method protocols accurately and safely. Candidates should be able to accurately and safely follow demonstration methods. Does the candidate perform relevant demonstration methods safely and accurately? Do they follow relevant protocols and SOPs? Do they use or automated method? Do they know if the demonstration method was followed accurately? When addressing this competence requirement, candidate could consider SOPs, method used, quality control, use of control material, training, competency, importance of following protocols, method reliability, consistency, reproducibility. The second competence requirement is select and use the correct staining or impregnation method to identify pigments and minerals present in different tissues. Candidates should be able to correctly select and perform relevant staining and impregnation methods. Does the candidate select and use correct staining methods to demonstrate pigments and minerals? Do they follow local protocols and SOPs? If not performed in-house, are they aware of stains used to demonstrate pigments and minerals? Do they perform the stains manually or use automated stainers? When addressing this competence requirement, candidate could consider the stains highlighted in the indicative repertoire and stains used in their methodology and SOPs available to them, whether the stain is automated or manual or both. The third competence requirement is select and use the appropriate control materials, maintaining appropriate audit trail records. Candidates should be able to select and use correct control material for demonstration methods and maintain audit trail. Does the candidate use correct control material for relevant demonstration method? Maintain correct audit trail for control material used? Do they produce appropriate control material for each demonstration method? When addressing this competence requirement, candidate could consider tissue types, verification, validation process, record keeping, traceability, audit trail, importance of selecting correct control material, consequences of not using correct controls. The fourth competence requirement is use appropriate microscopy techniques to visualize methods. Candidate should be able to view stained slides microscopically. Does the candidate correctly view stained slides via the microscope? Do they use correct microscope to visualize stained slides? Do they set up and use microscope correctly? When addressing this competence requirement, candidate could consider light microscopy, polarized light for minerals with crystalline structure, magnification, Kohler's illumination, digital image assessment. The fifth competence requirement is identify stained pigments and minerals present in different tissues. Candidate should be able to identify pigments and minerals on a stained slide. Can the candidate identify pigments and minerals on a stained slide correctly? Do they use correct microscopic technique to identify them? Can they identify the demonstration method used to identify carbohydrates? When addressing this competence requirement, candidate could consider microscopic examination of stained slides, demonstration method used and the target pigments and minerals and how it would look like on a stained section, their training and competence. The sixth competence requirement is assess stained sections for quality. Candidate should be able to assess quality of stained sections. Does the candidate assess stained section for quality correctly? Do they take correct steps during the assessment? Do they focus on correct features when assessing quality of staining? Maintain appropriate audit trail? When addressing this competence requirement, candidate could consider color consistency, uniformity, specificity, presence of background, consistency of staining, presence of non-specific staining, staining intensity, EQA assessment criteria, relevant documentation, control material. The seventh competence requirement is resolve any problems associated with the visualization, staining, or impregnation methods including root cause analysis, as appropriate. Candidate should be able to troubleshoot staining. Does the candidate resolve problems with staining correctly? Can they identify and solve the common problems? Do they record problems and resolutions accurately? When addressing this competence requirement, candidate could consider investigation, problem identification, corrective actions to fix the issue, preventive actions to minimize problems from reoccurring, communication, possible problems like poor staining intensity, poor specificity of staining, artifacts like uneven staining, hazy slides, presence of deposits or precipitate on the slide, reagent contamination, and so on. The eighth competence requirement is dispose of waste reagents safely. Candidate should be able to safely dispose waste reagents. Does the candidate dispose staining reagents safely? Do they follow local procedures and avoid risks associated with staining reagents? Do they segregate waste as per regulations? When addressing this competence requirement, candidate could consider licensed contractors used by your lab, waste segregation, safety data sheet of reagents that often state disposal ways, risk assessments, local policies, and regulations that are followed, health and safety risks associated with reagents like flammability, corrosivity, environmental toxicity. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when it's to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence, relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. You could ask the candidate to complete tables you created, based on knowledge requirements. You could ask them to identify infective agents and demonstration methods from digital images of your in-house demonstration methods. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.